they could seek en banc review rather than appeal to the Supreme Court, and that will add a number of months just within the Fourth Circuit. And who knows, if things go slowly, maybe the timing misses the 2011-2012 term of the Supreme Court, at least the window for it. And if that happens in all the appellate courts, then maybe they push it back one term. But that's not something it's only partially within their control. So when it comes to things within their control, I just don't think the answer to that question is a yes. They can try to delay somewhat in some cases, but last count I knew of, there were 31 cases running across the country, and all at various points. But by June 8th, 4 of them will have been argued at the circuit court level, and the 2010-2011 term isn't even over yet. So it strikes me as not terribly likely that this will get past the 2011-2012 term in the Supreme Court. It's possible, but odds are in favor of the next term. Anyone else on? Sure. Anyone else on the phone? All right. Well, yes, ma'am, in the room.
One follow-up, if I could. If the court were to rule that you do not have standing in the case, then what legal avenues would be available to you?
Well, it's the same. We would appeal to the Supreme Court.
On the standing issue.
They would not have addressed the merits. We would appeal the standing question, which by itself is an important question. It's important to preserve the state's ability to protect its own legal code in the federalist system at the Supreme Court, because each of these reviews is de novo, meaning that the lower court rulings don't impose a presumption in favor of one party or the other. You start over at the next level. We would ask the Supreme Court to address the merits anyway, and would rather expect other cases to be there with the same merits issues, meaning the Commerce Clause question under the individual mandate and the taxing and spending power question under the penalty for not buying the mandated health insurance, and of course the necessary and proper clause and how it addresses all of it. So, all right, thank you all. All right, one more on the phone, and we'll make this the last one.
Dave Burton at WSBT Radio in Mount Jackson.
Okay.
How are you today?
Doing very well, thank you.
Good. Thank you for your fight in the Court of Appeals. Can you tell us why, if you and assuming Governor McDonnell are against the implementation of this healthcare system in Virginia, can the governor actually stop implementing the healthcare system in Virginia while you're fighting this fight, or is he obligated to carry on?
Well, until a court says this is not the law, it is the law. And out of respect for the law and in prudent planning, the governor is pressing ahead to try as best he can to meet the deadlines imposed by this federal legislation. And there are other governors who are not doing that, but if we lose this case, it is going to be nearly unrecoverable in terms of the time frame for the other states to catch back up and get on schedule. And so they will be imposing on themselves some extraordinary logistical burdens that Virginia isn't going to live with. The flip side of that coin is it costs us money to get ready, and that's money not being spent for other things, be it healthcare, actual healthcare, as opposed to just setting up an administrative elements, various committees, various employees, and other things to prepare to implement this law. That costs money, and we expect, if we go all the way through the process, the cost estimate is $20 to $30 million just for Virginia. That doesn't count the other states, it doesn't count the private sector, it doesn't count any of those costs. But the alternative of not doing that, if we lose in what is clearly going to be a close call, is one that is difficult to contemplate from a governance standpoint, managing your state government as the governor has to do. So whether he likes the bill or not, and he clearly doesn't, it's still the law until, in our case, the Supreme Court's rules one way or the other. So, yes, sir. You all have a good day. Thank you for joining us.